Cancer is one of the major causes of death around the world. Though people are now familiar with cancer as a disease, awareness in terms of prevention and treatment is yet to reach the masses. Dr. Jonas Stumpf is a senior consultant radiation oncologist and advisor on oncology and cyberknife services at Apollo Specialty Cancer Hospital. Is there any particular cancer that is most prevalent in India which is probably caused by ignorance or negligence?
It's a very general question, I believe. Let us start at the end, the ignorance and the negligence. Almost everybody knows about cancer. It is the 21st century, in the media, everywhere. You are educated at school. The cancer is known. But how to detect the cancer and to have the cancer in the mind of the people as a possible disease, that is certainly missing. And if we can increase the awareness, and the media has a great role in that, then it will come to the position when the patients and the doctors, everybody would think more about cancer. A, it will eradicate the fear, especially the unnecessary fear of cancer. B, it will ultimately make the patients come at an earlier stage, so the level or the percentage of the curability will be much, much better. So that is the part. Otherwise, yes, there are certain kind of cancers which are caused by negligence and by the habits, the very nice habits of the Indians to spit everywhere and to chew everywhere and to chew tobacco especially. It is a very well-known fact that the tobacco chewing certainly promotes a number of cancers, not only in the oral cavity and the food pipe, but also others in the whole in the digestion system. And it is a big drawback to the Indian population, that kind of very bad habit. So if we can eradicate that, that would be a great step forward to have less incurable cancers. And I have been practicing cancer cure and cancer treatment for the last 40 years in different parts of the world. And I can tell you that that kind of very aggressive cancers in the head and neck region, sometimes with young individuals, I have never seen in any other part of the world as it is in India.
What are we observing on Cancer Day? In what way can people be sensitized about cancer? How can a common person contribute to the cause?
That is a very, very important question. To have different days, I don't think that the 365 days of the years are enough by now, because there are days for that, for everything. But I fully agree with you that the importance of the Cancer Day is one of the primary importances. And it is about spreading awareness. Cancer is a disease, and every one of us has a great risk of acquiring cancer. Me, you, others, even those who are sitting in front of the screen. But we have to handle it, we have to cope with it, we have to see what are the ways how an otherwise very fearsome disease can be kept under control. And one of the most important issue is to think about. And if you think about, then you will see the doctors quite early, and ultimately the cancer can be detected at early. So just an hour ago, a gentleman came who went with a simple inflammatory disease of the skin to the specialist. And the surgeon has scooped out, and he said, okay, it does not really look completely like a simple carbunculus lesion. Let me send it for the histopathology. And the biopsy has shown a very aggressive type of cancer, a lymphoma of the skin. So here it is that simply because of the awareness and the and the alertness of the doctor was there. Similarly, alertness of the patient. I'm having something which is uncomfortable. I have to see my doctor. So these are the things, and the cancer day will focus or can focus on that. And certain kind of cancers can be screened, which is certainly a kind of step for the early detection at a curable stage. And the cancer day, probably we should pass on the message that it is outdated, that the diagnosis of cancer equals a death sentence. It is not like that, though it has to be added that the cancer is still a very difficult disease, very complex, difficult to manage.
To what extent is it a fact that regular exposure to radiation causes cancer?
Well, regular exposure to radiation is our everyday's life. From the universe, from the wall of the building, from everywhere, we are having an exposure. Everybody, all kinds of living creatures on Earth. But about the effect, there was a nice research in the 20th of the last century, and Dr. Müller in the United States has received the Nobel Prize for his research when he ultimately proved that there is no threshold, there is no that much of small amount of radiation which theoretically would not cause a harm or damage. Yes, it is in a way true, but ultimately we have to go with the reality, and the point is that the humankind has been living for the millions of years with that kind of exposure. But there is an addition. There is an addition with the diagnostic use of radiation. There is an addition in the, for instance, any kind of nuclear research. But let me be very clear that there is no exposure in connect with, for instance, in a nuclear plant. But there is an exposure with the atomic bomb, provided it explodes. And we know by now lots of things after the Chernobyl accident, after the Japanese accident, and ultimately there is a fear, especially after the nuclear bomb which has been dropped to two Japanese cities at the end of the World War. And we have a fear, and it is good that we maintain a fear, but overreaction should not be there, especially if a cancer patient gets an appropriate treatment in the form of radiation therapy. The question is, no, this treatment will or will not bring other cancers. Yes, there is a higher risk that in certain places, especially with pediatric patients, when they are exposed to therapeutic radiation, then they will develop or have a slightly higher risk to develop a second cancer in the same area. But number one priority is that somebody has to be cured of that primary cancer. If somebody dies, then there is no risk of second cancer. But if the person was cured, then there is a slight couple of percentage more in that way. Otherwise, the radiation does not play a very substantial role in the cancer development.
Tell us the role of radiology in treating cancer.
There are two types of radiology. There is a diagnostic radiology and there is a therapeutic radiology. Both are hardly more than 100 years old. So not like surgery and not like medicine, which are both as old as the humankind, the history of the humankind is. So if I talk about the diagnostic radiology, I should talk about a new method which is not completely new, let me be frank about that, but the combination of a nuclear medicine is called PET with the CT. So the PET-CT is something new, which is a great new tool at the help of oncologists. But it is not a cancer screening tool. It is a tool where we can see the limitation or sometimes even the remote small seedlings of the cancer, and that is the PET-CT4. That is important. But in other ways, the diagnostic radiology has covered a huge development. Enormous is the development in that way. And that can help on a great way to the diagnostic, to the therapeutic radiology, because the therapeutic radiology is based on the fact that radiation, especially higher dose of radiation, can hurt cells, both normal cells and cancerous cells. And the cancerous cells are usually more vulnerable. So that is the basic principle of the radiation oncology, the therapeutic type of radiology. That means that I need to know exactly where the cancer is. Unless I know where are the limitations, where are the boundaries of the cancer, where is my target, there is no need to have a very sophisticated radiation oncology tool, because if I don't know the target, there is no need for a precise gun. But now, the pretty much balanced development of the diagnostic and therapeutic oncology radiation, they have resulted in a position when a small volume or larger volume of known visible imaged tumor can be very, very precisely irradiated, exposed with the therapeutic radiology, and can be eradicated. So there is a huge development in both the radiologies, and they are helping each other, shouldering each other's responsibilities.